Over 11,000 homeless individuals are cared for by Boston Healthcare for the Homeless program each year. We are committed to ensuring that every one of these individuals has access to comprehensive health care. Our clinicians, case managers, and behavioral health professionals work in more than 35 locations across our city to deliver the highest quality health care to some of our community's most vulnerable and most resilient citizens. Many of the patients we serve have substance use disorders. And while we strive to provide the best patient-centered care, we learn through a series of surveys and patient stories collected by members throughout our program that many patients are subject to stigmatizing language around substance use disorders, and it's used throughout our program, often unknowingly by our staff. A member of our community advisory board spearheaded this training program to be able to incorporate patient voice and lived experience to help our efforts in reducing the use of stigmatizing language around substance use throughout our program. The Language Matters training really worked on having the preface that clinical and non-clinical staff all have various levels of education around substance use disorders, which impacts the language used when engaging with patients from the time they walk in, receive their care, by the time they leave. So we developed an hour-long training that we offered to individual teams so they were able to apply this to their actual work and be able to inform staff on substance use disorders and stigmatizing language. The training is conducted by a clinical social worker and a member of our community advisory board. The training incorporates professional studies on stigma as well as direct quotes from our patients to help it resonate more. The training also offers alternative non-stigmatizing language bank that staff are encouraged to use post-training. The project aims, we really hope to educate clinical and non-clinical staff on the training objectives to reduce stigmatizing language used in clinical care and during non-clinical interactions. Through educating our staff, regardless of role in our organization, we hope to decrease the stigma patients with substance use disorders face while receiving care and services in our program. And by having a member of our community advisory board lead this training and co-facilitate it with our social worker, we're able to use direct quotes from patients, and attendees will be able to resonate more with the material and be able to connect what they're learning in this training to the person that they're sharing the elevator with. The training objectives for all staff are to learn to view substance use disorders as a chronic illness and describe the effectiveness of treatment for substance use disorders, review the concepts of stigma and the importance of therapeutic language and presence to fully engage patients in care, and really to understand how stigmatizing language influences power dynamics, affects patient care, and how patients perceive the care that they have received. We really wanted to strive in incorporating patient voice. A member of our community advisory board conducted a simple 6-question survey to patients in our OBOT program. And we also conducted a community needs assessment in an open drug scene tent encampment where 100 people without housing who minimally engage in healthcare or treatment for substance use were asked how stigma impacts their engagement and care that they hope to receive in the future. The presentation of patients with substance use disorders is a twofold process. For patients with substance use disorders, we really wanted our staff to realize that this becomes internalized. It reinforces trauma and distress, leads to negative views and mistrust of healthcare workers, and often leads to avoidance and fear of presenting for help, leading to minimal care. And for providers treating people with substance use disorders, we wanted them to understand the greater levels of implicit bias when stigmatizing terms are used to describe patients. There's a strong recommendation that we remove terms from documentation and medical charts to reduce implicit bias of other healthcare centers that may be receiving our notes via electronic medical records, and how substance use is discussed with the patients and how healthcare professionals need to use better language to help people recover from substance use disorders if that's what their goal is. Post-training, clinical staff were able to receive CEUs after completing the survey, and non-clinical staff were able to receive a certificate of completion for their HR file. Now, our anticipated results and goals As more teams participate in the training, we hope that stigmatizing language used throughout the program will be replaced with patient-centered, non-stigmatizing language, that initiation, engagement, and treatment for substance use disorders will increase for patients in our program. We hope to conduct yearly patient surveys on stigma, and that these surveys will show decreased stigma patients feel regarding substance use disorder while accessing care in our program, and that all staff will be trained on the impacts of stigma at new employee orientation and yearly refresher courses.